Hey guys, welcome back to my channel, The ENT Resident. In my previous class, I talked about what is tonsillectomy and what are the indications and contraindications of tonsillectomy. Today, I'll be discussing about the different techniques and the different methods that are present in tonsillectomy. You can also now purchase my notes. I have added links in the description. Okay, let's get started. Now, how can we classify the different techniques of tonsillectomy? So, we can divide them into cold methods and hot methods. Hot methods are where we are using temperature as a mode of dissection. So, let's discuss what are these methods, what are the different examples we know under each one of them. Now, cold methods, the first and the most commonly used method that we all follow is the dissection and snare method. I'll be discussing this in a separate video where I'll discuss the different steps of performing tonsillectomy using the dissection and the snare method. Second is the guillotine method, but this is an obsolete method nowadays. It is not used. Third cold method is intracapsular or capsule preserving tonsillectomy with the help of a microdebrider. Here, what we use is a 45-degree angled microdebrider with a setting of 1500 RPM. Now, advantages of using microdebrider is that the patient experiences less pain and also the patient can have a quicker return to normal diet. However, this also has a disadvantage, and the disadvantage is the chances of greater intraoperative bleed. Fourth cold method is harmonic scalpel using ultrasound. Now, what is the technique over here? This method uses ultrasonic technology to cut and coagulate the tissue, and that results in a very minimal tissue damage. The device basically converts electrical energy from a generator into mechanical vibration through a transducer that consists of piezoelectric ceramic, which results in a very back and forth vibration of the blade, and the frequency at which it vibrates is 55.5 kilohertz over a distance of 80 millimeter. So basically, there is a conversion of electric energy to mechanical vibrations or mechanical energy that happens over here, and this happens with the use of ultrasonic technology. What are the advantages of this method? It has better visibility, smaller risk of stay energy shocks, and less post-operative pain. Next cold method is coblation, which is a very up and coming method and it is very popularly used nowadays. This is also known as plasma mediated ablation. What do we do here? Here, it uses a system of radiofrequency bipolar electric current that passes through a medium of normal saline. It's important to remember the medium here, and this results in the production of a plasma field of sodium ions. These energized sodium ions that are produced, they are capable of breaking down intercellular bonds and vaporizes the tissue at a temperature of only 60 degrees. As you can see, that is why this is not a hot method. This results in the dissection with a very minimal post-operative pain, which is why this is a much preferred mode of performing tonsillectomy in today's times. The handpiece that you use, that the coblator, it is equipped with an electrode irrigation and a suction channel. The advantages of this technique is that it causes less post-operative pain, there's rapid healing, and quicker resumption of normal activities for the patient. The last cold method is cryosurgery. What is cryosurgery? Here, we use nitrogen at a temperature of minus 196 degrees Celsius at a pressure of 22 pounds per square inch. So the tonsil is frozen by applying the cryoprobe and then we allow it to thaw it out. So two applications are made, each of 3 to 4 minutes. The tonsillar tissue will undergo necrosis and later fall off, leaving behind a granulating surface. Again, this method is a very good method because bleeding is very less in this case, and this is its advantage. And bleeding is less because of the thrombosis of vessels, which is caused by freezing. So these are the 6 cold methods of tonsillectomy that we have, but the most common one that is being used nowadays is the dissection and snare method. But also more popular and upcoming ones are the microdebrider method and the coblation. Next, let's talk about the hot methods of tonsillectomy. There are 3 such methods. So, hot methods are one where we are using temperature as a mode of dissection. So, the first one here is electrocautery. Now, what is the advantage of electrocautery? Here, we see a significant reduction of intraoperative blood loss and operating time. But this also comes with its own disadvantages where there's increased secondary hemorrhage, increased postoperative pain, and slower healing in these cases. So this is about electrocautery. The second hot method is performing a laser tonsillectomy, usually done with the help of CO2 or a KTP laser. And amongst these two, KTP laser is the most preferred laser used in cases of tonsillectomy. The last method over here is radiofrequency. Here we use radiofrequency waves at 460 kilohertz and we have a bipolar electrode. The electrode has a temperature sensor which is for adjusting the output power to allow the precise control of tissue temperature and total energy developed. So this is the radiofrequency method of tonsillectomy. This completes all the different techniques or methods of tonsillectomy that we need to know about, and we classify them into cold methods and hot methods. In my next class, I'll be talking about what are the 2 different types of tonsillectomy. What is hot tonsillectomy and what is interval tonsillectomy? See you in my next class.